For far too long, AF ablation has a one-size-fits-all approach. Irrespective of where you are in your journey, you will get pulmonary vein isolation. Nothing less, nothing more. What personalized AF therapy means, I think, is choosing the right prescription for the patient in front of you. One thing that always has struck me is that atrial fibrillation is not only very common, but it's also very variable. So on the one hand, you have a 40-year-old elite marathon runner with vaguely induced paroxysmal atrial fibrillation. And on the other hand, you have an 80-year-old person with multiple comorbidities, hypertension, diabetes, sleep apnea, etc. How on earth can the two be absolutely identical? So it's a wide range. So I think AF presents differently for different people. But also, in the same individual patient, AF might present at different times of their lives. So you might have somebody with focal atrial fibrillation, paroxysmal atrial fibrillation initially, who might be treated with drug therapy or perhaps with atrial fibrillation ablation, then who might present years down the line with persistent atrial fibrillation. So again, what you might have chosen for that same patient when they're presented to you first time may be very different from what you'll offer to them 10 years down the line. There are several ways that one can achieve pulmonary vein isolation. So you can use it with single shot technologies, you can use 3D mapping with point-by-point RF technologies. You can also sometimes need to do more than pulmonary vein isolation. So having a whole portfolio means that you have the requisite skills and the tools to be able to achieve this in your laboratory. So for patients who just need pulmonary vein isolation, nothing more, you can achieve it quickly, reliably, efficiently with a single shot technology tool. If on the other hand you have a far more complex patient or somebody who's come back with AF recurrence in spite of isolated pulmonary veins, then you can use 3D mapping and focal RF technology. But it's also coming up with single shot technologies of both the cryo type as well as the radio frequency type. So you've got cryo balloon, which is very, very popular, and Boston is entering the space, but also radio frequency balloon. So if you were to ask EPs what would they like to have in their portfolio of being able to offer to patients to achieve AF ablation, most of them would say either a single shot technology or a focal radio frequency technology with 3D mapping. And Boston has covered both of those bases. Electrophysiology personalized means being an electrophysiologist. Okay? Over the last 10 years, I have seen too many of us electrophysiologists lose the electrophysiology from their practice. So I think having an individualized electrophysiology strategy means that you're looking at the signals, you're looking at the patient, you're looking at the underlying voltages, you're looking at pathways, you're looking at the mechanisms of atrial fibrillation, and you're trying to think your way through. It might seem horribly old-fashioned, but that's what attracted many of us to electrophysiology in the first place. So I think this is bringing electrophysiology back into the limelight. No, I still think we need to do a lot of research into the AF mechanisms beyond pulmonary vein isolation. It's a bit of a gray area at the moment. Nothing has really been shown to be effective beyond pulmonary vein isolation. A lot of us are seeing patients who are very advanced in the disease process, and we need to be able to find ways to get rid of their atrial fibrillation safely. And I think the tools that we have at the moment will allow us to understand those pathophysiological mechanisms a bit better than the tools we had in the past.